All right, everyone, welcome back to the channel. Today, we're diving deep into the fascinating world of medical technology, specifically focusing on the magnetic resonance MR device. This incredible piece of machinery plays a vital role in modern healthcare, providing doctors with detailed images of the inside of our bodies without the use of radiation. So buckle up as we explore what an MRI device is, how it works, its crucial applications, and the all-important safety aspects. Have you ever wondered how doctors can see inside your body without surgery? Well, the MRI device, often associated with magnetic resonance imaging, MRI, is a key player. Essentially, it's a sophisticated medical imaging tool that uses powerful magnetic fields and radio waves to generate detailed three-dimensional images of organs, soft tissues, bone, and virtually all other internal body structures. Unlike X-rays and CT scans, one of the biggest advantages of an MRI device is that it does not use ionizing radiation, making it a safer option, especially for repeated scans and for vulnerable populations like children and pregnant women, though with specific considerations. The science behind an MRI device is truly remarkable. Why does it produce such clear images? What exactly is happening inside that large, often intimidating-looking machine? When are these signals generated? Where in the body does this occur? Who benefits from this technology? How are these images created? At its core, the MRI device utilizes a strong magnetic field, many times stronger than the Earth's natural magnetic field. This powerful field causes the protons, which are tiny particles within the water molecules in our body, to align in the same direction. Then, the device emits pulses of radio waves. These radio waves temporarily knock the aligned protons out of their equilibrium state. When these radio waves are turned off, the protons release energy as they return to their aligned state. This released energy is detected by the MRI device. Different tissues in the body have different water content and thus different concentrations of these protons. They also return to their equilibrium state at different rates. The MRI device measures these subtle differences in energy release and the time it takes for the protons to realign. A powerful computer then processes these signals to create detailed cross-sectional images of the body. Think of it like listening to the echoes of tiny signals coming from within you, each echo telling a story about the type of tissue it encountered. The versatility of the MRI device has made it an indispensable tool across various medical specialties. Where in the body can it be used? What conditions can it help diagnose? When is an MRI the preferred imaging method? Who relies on MRI findings? Why is it so valuable? How does it aid in treatment? In neurology, MRI excels at imaging the brain and spinal cord, helping to diagnose conditions like multiple sclerosis, Alzheimer's disease, brain tumors, stroke, and spinal cord injuries. It can differentiate between white and gray matter in the brain and even map brain activity through functional MRI, fMRI. For cardiovascular health, MRI can assess the structure and function of the heart, identify congenital heart defects, and evaluate blood vessels through magnetic resonance angiography, MRA, which can detect aneurysms and atherosclerosis without the need for contrast agents in some cases. In musculoskeletal imaging, MRI is the gold standard for evaluating soft tissues like ligaments, tendons, muscles, and cartilage. It's crucial in diagnosing sports injuries, arthritis, and bone tumors. Weight-bearing MRI even allows for imaging joints in their natural standing position, revealing issues that might not be apparent in a traditional MRI. Furthermore, MRI plays a significant role in imaging the abdomen and pelvis, helping to diagnose liver diseases, kidney problems, tumors in various organs, and conditions of the reproductive system. It's also used in oncology for detecting, staging, and monitoring various cancers throughout the body. The high level of detail provided by MRI often allows for earlier and more accurate diagnoses, leading to better treatment plans and outcomes. While MRI doesn't use radiation, it's crucial to understand the safety aspects associated with the powerful magnetic fields it generates. What are the potential hazards? When are safety protocols most critical? Where do these risks exist? Who is responsible for ensuring safety? Why are these precautions necessary? How can these risks be mitigated? The strong magnetic field of an MRI machine is always on even when the machine is not actively scanning. This means that any metallic objects brought into the MRI environment can be forcefully attracted to the magnet, posing a significant risk of injury to patients and staff. Therefore, strict screening procedures are in place to ensure that no ferromagnetic materials, like iron-containing metals, enter the MRI room. Patients are typically asked to remove jewelry, watches, and any clothing with metal fasteners. Individuals with certain metallic implants, such as some pacemakers and older aneurysm clips, may not be eligible for MRI scans or may require specific protocols and monitoring. Furthermore, the rapidly changing magnetic fields and radio frequency pulses can induce electrical currents in conductive materials, potentially causing heating. While modern MRI systems have safety mechanisms to minimize this risk, it's important to inform the MRI technologist about any implants or medical devices. The MRI procedure can also be quite loud due to the switching of magnetic field gradients. Patients are typically provided with earplugs or headphones to protect their hearing. Claustrophobia can also be a concern for some individuals due to the enclosed nature of some MRI scanners. Open MRI machines are available, offering a more spacious environment for patients who experience anxiety in confined spaces. Ultimately, MRI safety is a shared responsibility involving the patient, the MRI technologist, and the radiologist. Clear communication and adherence to safety protocols are paramount to ensuring a safe and effective imaging procedure. So there you have it, a comprehensive look at the magnetic resonance MRI device. It's truly a marvel of medical engineering, providing us with invaluable insights into the human body. If you found this video informative, please give it a thumbs up and subscribe for more deep dives into the world of medical technology. Let me know in the comments if you have any questions or topics you'd like me to cover in future videos. Thanks for watching, and I'll see you in the next one.